For Town Square Media Montrose, I'm Belinda Haddock, and on behalf of Montrose Regional Health, we thank you for joining us for this podcast. Today, we're talking with Dr. Craig Peterson of San Juan Urology and Montrose Regional Health. How are you?
Great. Glad you could have me.
Glad to have you too. So we've got a list of questions that people might be interested in. And the first one is, what is Aquablation Therapy?
Well, it's a new therapy for benign prostatic hyperplasia, which is something that plagues at least half of men over the age of 50 and 90% of us by the time we hit 90, in that our prostates grow throughout life and obstruct the flow of urine, causing a lot of symptoms. And, there have been many treatments over the years for this malady, going back to Ben Franklin, who imported catheters from France, but that's another story. But this is the most recent treatment that I've come across that's now available at our hospital. It differs from a lot of other treatments for BPH in that it's not heat-based. It's based on a high-pressure water jet. Just like people who can cut metal with water jets, you can also take out prostate tissue, but it's much more precise and computer-controlled. And it's really the only surgery that I do that removes prostate tissue that also preserves sexual function in most men.
And you mentioned benign prostatic hyperplasia, also known as BPH, also called an enlarged prostate. Aquablation candidates, typically older men, right?
Correct. Yeah. Right now in our region, it's for men from ages 55 to 80. The age limits are going to be coming off very shortly. The original study that got approval from Medicare included men in that age group, so that's who is certainly available to get it now. But it's been proven in other age groups now, and shortly in our region, they're going to release those age requirements. But yeah, men over 50, as I said, all of us, if you have a prostate, it tends to grow throughout life. About 10% of people, it doesn't for whatever reason, but 90% of men, if you have a prostate, it grows throughout life and eventually can lead to some obstruction of your urine flow, which causes symptoms.
And what kind of symptoms?
Well, certainly, we have a questionnaire that's available on our website that goes over these symptoms, but most of the symptoms people are familiar with are getting up more often at night, having to strain to urinate, having the urgency to urinate without being able to stop it, having more frequent urination. All these are symptoms of benign prostatic hyperplasia. Of course, they can be symptoms of other things too, which is why it's important to visit with a doctor or urologist to try to sort out what's causing the symptoms.
And then if someone wants to go through aquablation therapy procedure, how long does that take?
So the process starts with a visit with our office. You come in and we do a discussion. We normally have something called a uroflow test where we see how fast the urine comes out of the bladder, and then we measure and see if the bladder is retaining urine after emptying. And then we have a discussion about the options. And then normally we have to do a further evaluation where we look in the bladder with a small scope and we measure the size of the prostate with an ultrasound. And that gives us an idea of what procedure will be best for each patient. It's very individualized treatment. And then if we decide on proceeding with aquablation, it's done at the hospital under an anesthetic. It's an outpatient procedure for about 80% of men. About 20% of men spend the night in the hospital just for a variety of reasons. Some of the patients come from far away, and we're just more comfortable keeping them in the hospital rather than sending them to Natarita or Grand Junction. But it's an outpatient procedure. And then after the procedure is over, normally we have a catheter for anywhere from 2 to 7 days, depending on how things are going. And then there's, of course, a healing process afterward. But in general, a lot of men are so pleased. It's one of those things they wish they had done years and years before.
And so it sounds like it's typically a short recovery.
It really is. I've done, again, multiple procedures in my career for this set of symptoms. And I find this recovery to be as gentle as anything we do for this condition. And, it really has the least injury because we're not doing any thermal injury like you would with a TURP which is another standard procedure, or a laser. There's no thermal injury. It's all this high-pressure room temperature saline. And so healing from that, I think, is easier on the body.
And you mentioned that a lot of men that come in for perhaps this procedure wish they had done it sooner. So expected outcomes would be getting the problems taken care of and a quick recovery.
That's exactly right. Getting the symptoms, improvement, better recovery. And of course, we talk about just the prostate being the issue, but it's not just this prostate. The bladder itself has changes that occur when it has to work against obstruction. Our skeletal muscle, our biceps, our quadriceps, those muscles get stronger when we provide resistance to them. They get bigger, just like weightlifters. But other muscles are in our body, like the smooth muscle, like our heart or our bladder, they do not like resistance. That's why people who have high blood pressure get congestive heart failure, because their heart has to work too hard and becomes thicker and less efficient. The same thing happens to the bladder. When the bladder has to pump the urine past obstruction, it becomes thicker and less efficient, and those changes can become permanent. So treating earlier in the cycle preserves bladder function as well.
That's good to know. Now, you mentioned that there are other treatments versus the aquablation therapy. What are the advantages with aquablation versus those other treatments?
Certainly, again, the lack of thermal energy certainly, I think, is a good point. It provides better healing. One of the things that almost all other ablative surgeries do is it eliminates ejaculation. So, it's a hard thing to talk about on a podcast, but that's an important thing for a lot of men. Most of these procedures do not affect erectile function. They don't affect the ability to get an erection. But virtually all ablative procedure, laser procedures, TURP procedures prevent ejaculation, whereas aquablation preserves that in over 90% of patients. So that's a very, one of those things that I really had kind of not really thought about a lot in my career, because the only procedures we had got rid of that. But now that we have one that doesn't, a lot of men who were not interested in a procedure become more interested. So I think that's an important differentiation between other ablative procedures and aquablation.
And if someone is maybe interested in finding out more, maybe they're experiencing some symptoms, maybe they're at the age where they need to get some help or find out more, you've got a prostate health seminar coming up.
That's right. We have a seminar. It's on June 27th at 6 p.m. And it's going to be at the hospital, conference rooms A and B. Myself and my partner, Dr. Michael Tonzi, who's recently joined me and also does the procedure. We'll be there to discuss this procedure and all the other prostate procedures we do, some of them in office, some in the hospital, and the differences and advantages and disadvantages of each procedure.
And so that's good news for gentlemen in our area if they, again, are experiencing some symptoms, maybe need to make a phone call over to your office, but everyone is welcome to attend this seminar on the 27th at 6 p.m. at the hospital.
Absolutely. It's on our website, sanjuanuro.com. It has directions, and there'll be light refreshments, and it's just a discussion, a time to ask questions in a more group environment so that it's not the pressure of a visit in an office type of setting. And
quick question, any cost to attend the seminar?
No, it's a free seminar, and again, refreshments are provided. We're happy to provide this to the community and promote awareness of this disease process and the innovative solutions we have available for it.
And Dr. Peterson, if somebody maybe, again, is experiencing some symptoms, maybe they come to the seminar on the 27th of June and then decide maybe they need to make an appointment with you. I see that you've recently located to a new location.
That's correct. Yeah, so we moved our office. The third time in my career I've moved offices, hopefully the last. I'm a big fan of moving. But our new office is really a beautiful facility. We're very happy to be there. It's right behind the drive-in movie theater in Montrose. Right across from the surgery center at 630 East Star Court.
And if someone would like to make an appointment with you or Dr. Tonzi, they can find you online at sanjuanuro.com, or they can give you a call at your office.
That's correct. 970-249-2291 is our office number. And, we're always happy to see new patients. Most plans do not require a referral from primary care. Some do. So you may have to go through your primary care physician to get a referral to us, but really most plans, especially if people are Medicare primary, they can call and make an appointment whenever they like.
All right. And again, that number is 970-249-2291. San Juan Urology, now located at 630 East Star Court here in Montrose, and online at sanjuanuro.com. Is there anything else you'd like to add, Dr. Peterson?
I really appreciate your time and getting me on this podcast, and I'm really looking forward to bringing this exciting new technology to our community. I've done over 60 of these procedures already since we've gotten the technology, and the results have been really fantastic. I've been very pleased.
Thank you so much, Dr. Peterson, for visiting with us today. And make note, once again, that prostate health seminar, you can learn more about aquablation therapy and other therapies. It's happening Thursday, June 27th, 6 p.m. at the Montrose Hospital Conference Rooms A and B.
Very good.
Thank you for listening to this Montrose Regional Health Update. Information provided in this podcast is for informational and educational purposes only and is not meant to diagnose any condition or provide treatment advice. Please work with your healthcare providers to determine appropriate treatments for you.